Martin Coady, plastic surgeon from UK, who has frequented our APSICON. This particular APSICON, he's here as a curator of the historical collection of British Association of Plastic Surgeons, and he's going to tell us about Gillies and India.
Well, thank you very much, Mr. Chairman, Madam Chairman. It's a great pleasure and a privilege to be back here at APSICON, a meeting I've come to several times and always enjoy. And thank you to the organising committee for allowing me to be here. Now, we've heard the name of Harold Gillies several times at this meeting, and many of you know his name, but fewer may know his part in the early history of organised plastic surgery in this country. And throughout this presentation, please forgive my pronunciation, which will be laughable to many of you, and for the use of some old-fashioned city names which crop up here. So Gillies is widely recognised as one of the founders of modern plastic surgery, and for us in the UK, the instigator of the British Association of Plastic Surgeons, which became BAPRAS. He was born, of course, in New Zealand, in Dunedin, educated in England, and went to medical school at Cambridge and St Bartholomew's Hospital in London. Now, his nascent career as an ear, nose and throat surgeon was thwarted by the outbreak of World War I. He was sent by the Royal Army Medical Corps as a major to northern France, where he witnessed the gross maxillofacial wounds now survived by hundreds of soldiers in what was the first mechanised trench-based war. And he became convinced quite rapidly that there was a need for surgeons specialising in facial reconstruction. So he managed to persuade the British Army medical authorities to allocate him first a ward at this Cambridge military hospital in Aldershot, and then to build him a complete new design hospital to his own design in southeast London at Sidcup, dedicated to the management of servicemen with severe facial injuries. Now at Sidcup, he developed probably the world's first true plastic surgery unit. It was a multidisciplinary hospital concentrating resources and teaching in this strange new art, as it was called. And it was here that he arguably invented the integrated care record, incorporated medical illustration as a note and teaching methodology, and co-developed the tube pedicle flap, the first method of reliably importing large quantities of well-vascularized tissue into huge defects. Now, as one of only 4 plastic surgeons in Britain at the start of the Second World War, he set up another unit, this time at Rooksdown Hospital near Basingstoke in Hampshire. And here he continued innovating and pushing the boundaries of plastic surgery. And here too, he trained many young international plastic surgeons who became the foundation of the specialty in the post-war period, including Ralph Millard, with whom he wrote, to some frustration from Millard, The Art and Principles of Plastic Surgery, but also several Indian trainees, including someone on the left that I only knew before today as Sharma from Delhi, but Dr. Mukund Thate tells me that this is Sharma probably from Lucknow. But it's written on the back of the photograph, Sharma from Delhi. And the man on the right, whom Gillies called that delight of a man, Dr. N.H. Antia. Now, he also said, we have enjoyed our Indian house officers, they're good. Obviously enlightened by them, he accepted a request to come here and arrived on November 21st, 1957 for his first visit. Now, by this time in the late 1950s, Gillies was in his mid-70s and he had symptomatic atherosclerosis. He had intermittent claudication, which limited him a little bit. But his first wife, Lady Kathleen Gillies, had died of leukemia in mid-1957. Later that year, his longtime theatre sister, Marjorie Clayton, upon whom he already relied a great deal, offered to marry and look after him. Don't we all need theatre sisters like that? On his first visit, having spent a couple of days in Mumbai, Gillies went on to Pune, initially as the guest of Dr. Coady, I think that's similar to his pronunciation, at the Jahangir Hospital. Now, Antia was also at the time in Pune, only later obtaining a post at the JJ in Mumbai, maybe with the help of a reference from Gillies. We certainly have a reference on letter from Gillies about Antia. Now, at this stage, Indian plastic surgery was at the point akin to that of Britain some 2 decades earlier. Antia was one of only 4 or 5 plastic surgeons whose work was entirely within the discipline, but there was no properly established plastic surgery specialty in the country. Only the year before, in 1956, had the ASI passed a resolution to form an Association of Plastic Surgeons of India as a subsection of ASI itself. Now, Gillies' purpose in coming was to use his fame, notoriety within the specialty to further and popularise knowledge of plastic surgery amongst the great and the good in India. Indeed, everywhere he went, he was introduced as the revered father of modern plastic surgery, and he was quite overwhelmed by the hospitality and interest of his hosts, which of course we all are when we come here. Now, in turn, the locals said they were pleased that Gillies was surprised that the sophistication of reconstructive work being done here was much further advanced than he'd imagined, with a lot of tube pedicles and stuff going on. Now, we can see from this typed itinerary that we have in the collection that he stayed for 2.5 months operating and lecturing. He visited Pune, Patna, Mumbai, Delhi, where he got himself arrested for taking a photograph of the president's house, and then to Agra and Darjeeling and Kolkata. Now, those who know anything about Gillies know he was a bit of a polymath. He had a wide range of interests. He played amateur golf for England, he fly fished a lot, and he invented things. He invented the high tee for golf and this new design clothes hanger, which I've managed to reproduce in wood myself. But mostly he painted. He took his easel and paints everywhere. And in Pune, particularly, he completed several works whilst he was there, which we have in the collection. One by insisting on climbing Mount Parwati alone after a long day's operating and got lost. His hosts lost him for several hours and got very worried about where he was. This is his view of Kanchenjunga, presumably done from Darjeeling in 1958. Now, Antia particularly remembered his tremendous energy and ability to keep going, especially for someone of 75 with peripheral vascular disease. Nevertheless, he managed to faint twice on this trip, once when he was on a visit to the Taj, and another time which worried his hosts. So his travels weren't just about surgery. They included quite a bit of sightseeing and meeting of dignitaries. We've got this this diary he kept in a little locally purchased notebook of his whole trip. And you can see from the underlined section here that he met Sherpa Tenzing Norgay, presumably again in Darjeeling when he was there. But crucially, on the 27th of December 1957 in Nagpur, he attended the ASI conference. And on the bottom right there is the invite to the inaugural event of 1957. The other one is from the meeting in 59. Now, it was at this event that the APSI held its inaugural meeting, electing R.N. Cooper as its first president and making Gillies its first honorary member. Now, Antia noted that his presence at that meeting created quite a stir in the Indian medical hierarchy. For the first time, Antia said, plastic surgery was recognised as a specialty in its own right. Now, having left for home in mid-January 1958, Gillies was back again by November 1959, again for 3 months. Accompanied again by Lady Gillies, whom in India he referred to specifically as not his wife, but as Miss Clayton, my surgical assistant, lecturer to nurses, and secretary, which she surely was, as well as his wife. He went back to Cooper, and Antia, who was now at the JJ, and this picture is from the JJ, and we believe that that is Antia in the front leaning over, where the first unit in India, as I understand it, had been established between his visits in November 1958. Now, on that trip, he gave 27 lectures, one for 4 hours, using 200 slides, 200 glass lantern slides. As a small illustration of how formative these lectures were for many of the trainees here, Professor Venkataswamy tells the story that Gillies' lecture at MMC was the first time that he himself had heard the words plastic surgery. Now, Gillies also spoke to the All India Leprosy Conference on that visit and to All India Radio on 2 occasions. He listed doing 41 operations, demonstrating many of the procedures he was well known for. But his visits weren't simply about teaching, they became a mission to assist Indian surgeons establish plastic surgery as its own specialty. He was especially keen to establish organised burn care in the country. He was really disappointed that the government didn't seem interested in his visits, but he nevertheless made it his way to talk to Buttonhole, the Surgeon General of Maharashtra, impressing upon him the need for specific plastic surgery units and units managing burns and leprosy. He was especially keen to organise burn care. So in March 1960, shortly after his return home, he rattled off a formal report to the Surgeon General in Mumbai and made the case for the establishment of more plastic surgery and burns units. And I understand that it did become quite an influential document in furthering the cause of plastic surgery here. Afterwards, in a letter of thanks to Gillies, which we also have, Dr. Rangia of Chennai observed, "It's bewildering to recall how our country, once adept in plastic surgery, could have relegated it to the limbo of forgotten practices." And in reply, Gillies observed, "I visualise that India is going to stage a comeback in plastic surgery." Cooper also wrote to him and thanked him for his selfless efforts to stimulate an interest in this branch of surgery. And he said, "May you live to see plastic surgery make a good beginning in India." But in September 1960, Gillies died of an aortic aneurysm, not long after he'd got back, probably before seeing Indian plastic surgery flourish once more. In a letter to another pioneer here, Dr. C. Balakrishnan, Gillies had said, "I think I did accomplish something towards putting plastic surgery on the map in India." Now, were he here today, I think old Sir Harold would be proud and very satisfied to have played even a small part in prodding the authorities to assist the establishment of Indian plastic surgery to become a specialty in its own right. Now, just a little bit of advertising. As the custodian of the history of British plastic surgery, next month we're about to launch what we've grandly called a virtual museum, which showcases quite a bit of the stuff we've got in our collection and the history of plastic surgery in Britain. It's not going to be fully open, the rooms are going to be partially empty, but you might want to log on to that to see some of the things we've been doing. Thank you very much.
Since you are going to have a museum, I had 2 instruments which were used by Gillies. One is needle holder, which I gave it to Prabha when she became the president. It is with us. And one is drill machine, hand drill. So if you like, we can give it to you. And another thing, he painted that fisherwoman you showed with the nasal deformity. He painted that painting with his hand.
Did he?
Yes. So I can add to that whenever you want to have a museum, we can contribute those.
Well, that's a very kind offer. I'll maybe speak to you afterwards. I would suggest, however...
I took it over from NHA.
I would suggest, however, that because even though that, on the painting, I'll take you up on that offer.
I took it over from NHA,
but
so I have a lot of that material.
I've been talking to Dr. Mukund Tata this morning, who is essentially my equivalent here, and I think you need to start a repository of essential artifacts of Indian plastic surgery in this country, and a collection like we've got. And because we have quite a few instruments of Gillies with his initials on, I would suggest you keep those as examples of instruments that came here.
I will cherish it. I don't think I will part with you to you.
Definitely cherish it.
Thanks for enlightening us about so much about Gillies. Thank you very much. Now